Good day everyone, I am Crizelmi Evan, student nurse from North Valley College Foundation Incorporated. And today I am going to perform my return demonstration for the bed bath. First, what is bed bath? Bed bath is a bath given to a weak or a bedridden patient who couldn't be able to do the self-bathing. So, the purpose of bed bath is to cleanse the body of the patient, to improve the stimulation of blood circulation, and also to promote comfort and relaxation for the patient. But prior to the procedure, I ensure that I already wash my hands and perform a proper hand hygiene in order to eliminate microorganisms that I could be transferred to my patient. And also, I would have here my equipment. First is the basin with warm water, personal protective equipment, a washcloth, bath blanket, towel, alcohol, lotion, powder, working gloves, soap, shampoo, and comb. I also have here extra water for refilling the water of my basin. So, to start the procedure, I will first check the chart of the patient. So next is I will identify my patient by asking her name and her birthday. So good day ma'am, I am Grizel, a student. First ma'am, I would like to ask for your name and your birthday. State your name and your birthday ma'am.
I'm Dina Evan, 50 years old.
Okay.
My birthday is June 10.
Okay ma'am, thank you. After that, explain the procedure to the patient. So, ma'am, today I am going to help you to refresh your body, to cleanse your body by giving you the bed bath. So, first, ma'am, I am also going to touch some parts of your body, and it is okay for me if you could do some things like cleaning your perineal area if you can do it your own. So, I will proceed with the procedure, ma'am. So before starting the procedure, I will ensure to give my patient a privacy, and also if the room is air conditioned or have electric fan, turn it off to keep the warmth of the patient. After that, since I will already wash my hand, I will just use alcohol to sanitize it before donning my gloves. Bed bath to my patient, I prefer to wear a PPE in order to avoid soiling my uniform. I will continue or proceed to the procedure. So, Ma'am Dina, I am going to request if you could be able to remove your mask. Okay, thank you, Ma'am. Next is I will lay a bath blanket over the patient. After that, since the height of the bed is not comfortable for me to work, I will adjust the height of the bed. Next is I will remove the cloth of the patient. Then I will dispose it properly in the corner or in a sorting basket. So after disposing the cloth of the patient, I will proceed with the procedure. So next is I will remove the pillow and put a rubber sheet underneath the head of the patient in order to avoid wetting the bed or the bed cover. So ma'am, I request Yes. Okay, ma'am, lay down. Okay, thank you. Are you comfortable with that position now? Okay. Next is, I will ask the temperature of the water if it is okay for the patient. So, mom, will you put your finger in the water? Is the temperature okay with you, mom? Okay. So, before I will wash your face, would you allow me to use soap in your face?
No.
Okay, mom. So, in washing the face of the patient, I will create a mitten in this washcloth and put it in the basin. First is I will wash the eyes of the patients from the inner corner to the outer. So first is the left side and then the right side. Next is after cleaning the eyes, I will turn the washcloth to the other area and wash the forehead of the patient up until in the mouth and the nose. After that area, I will wash the ears until the neck of the patient. So again, I will turn the washcloth Next, after washing the patient's face, expose the fat arm of the patient and put a towel under the fat arm of the patient in order to prevent wetting the bed cover. So, in cleaning the fat arm, clean it using a long stroke in order to improve the circulation of the blood of the patient. So, from the arm of the patient up until the armpit. After that, I will put the basin underneath the patient's hand and use soap in cleaning the patient's arm. Dry the patient's arm using the towel underneath her arm. So after that, repeat the same procedure to the other arm. So since my patient is an inch away from me, so I will ask my patient to move near to me so that it would be comfortable for me to do the procedure on the other arm. So mom, can you move? Okay, thank you. That's enough, mom. So that's enough. So, since my water is already dirty, I will dispose it and refill another water. fat arm of the patient, put a towel across the chest of the patient, and move the back blanket up until the umbilical area of the patient, and I will soak the abdomen of the patient. And in washing the chest area, ensure to pay attention in the skin fold because dirt usually in the skin folds of the patient. So, since my patient is female, I will give extra attention under the breast because the skin fold under the breast usually accumulates more of the dirt that we have. So, ma'am, can I remove your brazier?
Yes.
Okay, ma'am, I will remove your brazier. Would you please lean aside? Okay, ma'am. Okay, ma'am, thank you. So, I will dispose this brazier because it is already dirty. Then, after removing the brazier of the patient, I will continue with the procedure. After that, so for it be easy for me to cleanse the chest of the patient, I will just mix the liquid soap to the water and apply it using a washcloth. Again, I would refill my water with the clean water. Next, in rinsing the chest of the patient, I will dispose this used washcloth and use another clean washcloth. So after cleaning the chest, I will lower down the blanket to the perineal area in order to clean the abdomen of the patient. And again, always pay attention to the skin folds. After cleaning the abdomen, return the blanket to its position and expose the legs of the patient. So next I will going to clean the legs of the patient. So I will turn back the blanket and remove the towel. And I will expose the feet of the patient. So in cleaning the feet of the patient, always start in the ankle to the knee before the foot of the patient. Then in cleaning the foot, put the foot inside the basin with warm water. So first I would wash the ankle of the patient. refill my water with a clean one and rinse the feet of the patient. Don't forget to use a firm long stroke in order to improve stimulation of the blood. Next, after that, return the blanket or cover the feet of the patient. After that, I will wash my gloved hands, and because it is already contaminated after washing the gluteal area of the patient. Then I will change or refill the water in the basin with a clean one. Next is place a towel underneath the patient buttock. So, ma'am, could you please lean aside? Okay, ma'am, thank you. Next, after that, clean the perineal area of the patient because cleaning the perineal area will reduce the odor and also decrease the chance of infection. But first, I would ask my patient if it is okay for her that I will do the washing in the perineal area. But if she would not allow me, if she could do it herself, allow your patient to do it by herself. So, mom, is it okay for you to that I will clean your perineal area, this area here? Since the patient would not allow me and she will do it by herself, I will disclude those procedures in the video. So I will proceed in cleaning the back of the patient. So, mom, could you please lean inside? Thank you. Okay. So I will lay a rubber sheet underneath the towel so that I would avoid to wet the bed sheet or the bed cover. Okay. I will clean the back of the patient. So cleaning the back, I would use another sheet of washcloth and a clean water. While cleaning the back of the patient, use a firm long stroke to improve circulation and also pay attention if there is any redness or discoloration in the patient's skin. That, remove the rubber sheet and the towel. And assist the patient to lay back to its position. So, mom, so after doing that, help the patient to wear another set of clean dress or clothes. So before helping the patient to wear a clean cloth, so I will first remove my gloves since it is already soiled. Okay, ma'am, I request your hand. Okay. after that, remove the towel underneath the patient's head and put the pillow underneath the head. Next is remove the back blanket. Next is I will adjust the height of the bed so that my patient will be comfortable. So, are you comfortable with that position, Mom? Okay. So, that concludes my return demonstration for the bed bath. Thank you.